everyone, and welcome back to my channel. It's so good to have you here. You're welcome, you're welcome, you're welcome. Please don't forget to like, share, and comment on this video, okay? And please don't forget to subscribe. There's a subscribe button close to my name, a red button. Please don't forget, just click it, and anytime I upload a new video, you'll be notified, okay? Please, please, please. So right into our topic for today. Today we'll be talking about pelvic inflammatory disease, that is PID. So PID is an inflammation of reproductive organs of women. Okay, so this infection is caused usually by bacteria. Okay, bacteria that goes into the system, from the vagina to the cervix to the uterus and to the fallopian tubes and the ovaries. Okay, so this in bacteria can be the normal flora, normal bacteria that is supposed to be outside of the vulva going up. We call it ascending infections. But it could also result from STIs when you're having unprotected vaginal sex and probably you have multiple sexual partners, or the person you're having sex with is infected with an STI. Once you have sex with that kind of person, it's possible for you to develop PID. So what are the symptoms? What are the most common symptoms of PID? First of all is pain. Pain in your lower abdomen that is very severe, pain in your lower back, and pain that could occur during sex. Okay, so primarily you feel those pain, and especially in your lower abdomen and the back. It's very common with PID. Secondly, you can experience vaginal discharge. Vaginal discharge that is abnormal. Okay, abnormal vaginal discharge. Abnormal vaginal discharge that looks greenish and yellowish and has a very foul odor, because normal vaginal discharge is supposed to be milky white, okay, with no odor. But when you begin to experience vaginal discharge that is colorish, let's say yellowish or greenish, and has some sort of odor, is something that you should look into. Okay, then thirdly, you can experience fever, especially if the PID, if the infection has gone far and into your system. You begin to experience that kind of systematic symptoms. Then you can have burning sensation, especially when you want to pee. When you go to pee and you find it that it's painful for you to pee. And you can also experience itching and discomfort around your vulva. The vulva is the area surrounding the vagina. Okay, so please, when you begin to experience itching there, sometimes it will itch to a point that you scratch and you begin to injure yourself. That is a probably sign of PID. Then lastly, when you experience irregular cycles, okay, because PID can result in your period coming very late. It can result in your period coming in between cycles. Let's say you have a cycle this week, within the next 2 weeks you experience another cycle, like it's irregular. Or sometimes it will be that even after let's say you have a usual cycle of 30, right, it will stay for more than that 30 days. And let's say if you're sexually active, sometimes you begin to think that okay, you're pregnant, but you're not pregnant, it's PID. So very important. These symptoms are what can point to the fact that you have PID. So what do you do when you have PID? Okay, you go to the hospital. Very important. You go to the hospital or check with your healthcare provider. Some tests will be carried out, and when those tests are carried out, you can take a swab from your vagina, or they will take blood test. Okay, or they can request for an abdominal scan or an abdominopelvic scan to be carried out. That can give a picture of what is happening inside, and that way they are able to know the severity, and they are able to determine what kind of dosage, what kind of prescription. Would you take tablets or would you take injections? Okay, very important. You check with the hospital. Don't just go taking some kind of unprescribed medications. PID is quite easy to treat, but it's very important that you go with the prescription that is given to you, and you follow through the entire course of treatment. Because once you don't complete the course of treatment and it comes back, antibiotics can develop some sort of resistance that whenever you come back to take the drug again, it won't be effective. So very, very important, once you start taking your treatment, please ensure you finish taking it. Who is at risk of getting PID? If you're sexually active, if you have multiple sexual partners, you have partners that are infected, you are at risk of developing PID. So that's why we counsel about having protected vaginal sex. You don't just have sex without protection. Very, very important. Okay, so what are the complications? Why do we actually need to know about this disease, and why do we need to treat it? How important is it to us as women? Okay, so there are complications that can result from untreated PID. Number one is that it is a cause of infertility in 10% of women. Okay, they said, according to research, 10% of cases of infertility is resulting from PID, unresolved PID, untreated PID. When you have PID at any point in your life and you didn't treat it properly, it could result to infertility in the long run. You could develop scarring in any of those organs that I mentioned, whether the fallopian tubes or the uterus, and that could affect implantation. Okay, it can even result in ectopic pregnancies, where when the ovum or the egg is supposed to implant in the uterus and the uterus is scarred, it implants in one of those organs, maybe the fallopian tube, and then you begin to find that you're in pains. And ectopic pregnancy is a very, very life-threatening disease. Okay, so please make sure that when you have PID, you go for treatment. When you see all of those symptoms that I mentioned, you go for treatment, and you ensure that you treat it properly. Ensure that you are treated. Ensure that your partners, any or all of them, should be treated and should complete the treatment, so that you don't keep wasting your time. Because even if you treat yourself and your partners are not treated, you're just wasting your time. Because once you have sex with them again, you will become infected again, and becoming infected and infected and infected in the long run is not good for your health. So prognosis is good. Most times within 14 days of treatment, it's completed. Please ensure you complete treatment within those 14 days, because it's usual for symptoms to just go away after 24 hours or 48 hours of management. But please ensure you complete that treatment of 14 days. Even if you've stopped feeling the symptoms, make sure that you complete the treatment as prescribed to you by your health personnel. And if after that treatment you did not feel any sort of improvement, please go back and ensure that you are treated properly and everything has resolved, so that you are sure that you are free, so that you will not have any of those complications that I mentioned. So thank you so much for watching this video. That's all I would have to share today about PID. If you have any questions or clarifications you need, please don't forget to comment on the video. Just put a comment and I would respond to that. Okay, and if there's any video you want to make for me, any topic you want me to talk about, or if there's anything you really want to know, please just notify me in the comments and I would respond to that. Please don't forget to like, share, subscribe, and I'll see you guys in my next video.